We live in a world wherein patient care is no longer just limited to our nurses' hands. We are quite welcoming new gears in the peak of this innovative age. Good day, everyone. We are Group 1B from BSN 3E, presenting to you the attitudes of nursing students on the emerging trend of robotics in the nursing profession. I am Isabel S. Argabio.
I am Kyna Christtia D. Baroa.
I am Julienne Batac.
And I am Razel Kyla B. Bayato.
As technology rapidly advances, robotics is becoming a significant part of healthcare. This study aimed to determine attitudes of nursing students towards this trend, specifically focusing on how these attitudes vary across various demographic variables such as age, sex, and year level.
For the research design, the researchers utilized a quantitative descriptive design to interpret the levels of attitude, identify trends, and quantify responses without manipulating any variables, also through the use of a survey questionnaire.
As for the study's sample size, we selected 311 nursing students out of 698 from levels 2, 3, and 4 who are currently enrolled at a local university. We utilized stratified random sampling with Cochrane's formula at a 5% margin of error and a 20% attrition rate. The online wheel of names was also used to ensure fair selection of participants.
Proceeding to the instrument, the questionnaire was first comprised of a set of questions that entailed the demographic profile of the participants. The second part was an adopted standardized questionnaire entitled Negative Attitudes Towards Robots, or NRes scale, developed by Nomura et al. 2006. It is a 14-item questionnaire consisting of 3 subscales: the negative attitude towards interaction with robots, the negative attitude towards social influence of robots, and the negative attitude towards emotional interactions. We utilize a 5-point Likert scale with 1 as strongly disagree and 5 as strongly agree. The Cronbach's alpha scores of 0.75, 0.78, and 0.64, respectively, indicate an acceptable construct.
For the results and discussion on the demographic profile of the participants, majority of them were over 20 years old at 57.6%, while 42.4% were 20 years old and below. Moreover, a huge part of the participants were female at 71.7%, and males accounted for only 28.3%. This is supported by Perdida's study back in 2023, which highlighted that nursing continues to be a female-dominated field. As for the year levels, Level 2 students made up majority of the participants at 39.2%, followed by Level 3 at 33.8%, and Level 4 at 27%.
Proceeding to the levels of attitude, results showed that those aged over 20 and 20 below had moderate negative attitudes with a mean score of 43.17 and 43.04 respectively. When grouped by sex, females had a higher moderate negative attitude at 43.52 than males at 42.02. When by year levels, Level 3 students had the highest moderate negative attitude at 43.77, followed by Level 2 at 42.94, then Level 4 with a mean score of 42.48. Overall, the levels of attitude showed a moderate negative attitude with a mean score of 43.10. This can be observed by Majid Pana et al.'s study back in 2025, where they found that students expressed concerns regarding confidentiality and reduced empathy. These results suggest that cautious attitudes towards robotics are rooted in perceived threats to the core identity of nursing care.
In terms of the relationship between the levels of attitude and the demographic profile, the results indicate that age, sex, and year level do not have a statistically significant association with attitudes toward robotics in the nursing profession. This further suggests that students tend to exhibit similar attitudes due to shared learning experiences and exposure to technology in nursing education.
As for the difference between the levels of attitude and the demographic profile, there is no significant difference in the attitudes when grouped according to age, sex, and year level. This consistency across groups suggests that attitudes toward robotics are not strongly influenced by demographic factors but reflect a shared perspective among nursing students.
Proceeding to the conclusion, the researchers found that nursing students demonstrate a moderate negative attitude towards the emerging trend of robotics in the nursing profession. presenting a common cautious attitude regardless of demographic characteristics. These findings suggest that necessity of incorporating robotics into nursing education through accessible strategies.
For the recommendations to the university administrators, establish international collaborations with countries that are integrating robotics in their healthcare and invest in robotic equipment and simulation-based training in the long run. To clinical instructors, coordinate seminars and hands-on clinical activities that bridge the gap between patient care and technology. To nursing students, be proactive by reviewing current literature and seeking exposure to healthcare technologies beyond the classroom.
To patients and healthcare recipients, participate with students during interactions and provide feedback regarding to their care. To nursing researchers, prioritize the development of curriculum-based interventions that combine experiential learning with technological exposure. Lastly, to future researchers, expand the scope of the study and incorporate other variables such as technological exposure and cultural influences to have a comprehensive understanding of factors that affect attitudes.
Moving forward in this developing society, it is important to recognize that patient care is also no stranger to emerging technologies in the nursing field. Thank you for listening.